What is body work for your horse? You will hear the term used. I just had some body work done on my horse. Generally what people are referring to are practitioners of either chiropractic or osteopathy who are working on the large muscle groups of the body. Horses have what's called an axial skeleton, which is the skeletal structure that involves the neck, the back, and the pelvis, and it has an appendicular skeleton, which is really the skeleton of the limbs. So when you're dealing with a lameness issue in your horse, you're dealing with the appendicular skeleton. When you're talking about the axial skeleton, again, you're talking about that large midline skeletal structure. And people who do what's called body work on the axial skeleton part. So what are they doing? What is happening in those regions? Well, the major item that they're looking for is areas of that axial skeleton where the movement is not normal. And so many of them, particularly chiropractors, do what's called a motion palpation. The goal of a motion palpation is to try and test those areas of the neck, back, and somewhat the pelvis, where when you stimulate them, there is normal, what I call elastic to and fro motion. There's a give and take component to those structures. And people who do body work are looking for areas where the movement, there is no good give and take. You may have good give and take movement in the neck. You're going down the back and you hit a spot where you try and motion that area, and it feels very restricted, and there's just no give and take to those tissues. And they are going to incorporate a series of what they call adjustments to try and remobilize the area. And the essence of body work is that. Try and identify restricted motion, then through some type of adjustment or adjustments, apply them and see if you can restore motion to that area. Now, I think most of us are quite familiar with the large superficial muscles of a horse's body. They are mainly muscles of motion. They're the muscles that let a horse move from spot A to spot B at high speed if necessary. The muscles you can't see that a body worker is trying to address are what are called the postural muscles. They're the tiny little muscles that invest the spine. They're very important for proper posture of those deep vertebral segments, and they're the ones that largely get affected with issues that a body worker is trying to address. So you can ask, well, how can they address them if you can't feel them? They're buried that deep. You do have to try and feel for the restricted movement through all the superficial muscles down to the vertebral level. You're not feeling isolated muscles, you're feeling a segment of bone with its attendant ligaments and its small postural muscles that for whatever reason has developed restricted movement, and then you're going to try and do an adjustment to activate those deep postural muscles in a way that movement is restored. Who should you get to do body work? There are a lot of people who are quote-unquote body workers. Some have had extensive training in the areas. Others have had little to no training. And it can be very difficult to sort out what practitioner do you want working on your horse. A good way of investigating that is to ask other horse people whose opinion you respect. Ask them if they use someone like that and what their experiences have been. There are many veterinarians who have taken advanced training in these disciplines of chiropractic and/or osteopathy. Veterinarians are already trained to look at lameness issues, which can be part of the problems that a horse needing body work has. So if you can find a veterinary practitioner who does body work, I think that gives you your best option of addressing both lameness and body work issues.